Hey everyone, with polycystic ovarian syndrome, we're always looking at new research and evidence-based approaches to helping patients gain cycle regularity, how to basically take control over their hormones, and how to support them in a very crucial part of their IVF journey, which is, overcoming a lot of the common barriers which we see with PCOS, such as usually patients with PCOS don't tend to respond very well to medications. The type of follicles that grow usually tend to be lower quality, and pregnancy rates as a result of this can be a bit lower. So, there's a really wonderful compound that I'm going to chat with you about today, and it seems to be very promising for the treatment of PCOS and how it can be beneficial not only in natural cycles for patients trying to regain their cycle regularity, but also helping with these IVF and assisted reproductive technology fertility outcomes. So the compound that is we want to discuss today is called Inositol. And there was a brilliant new research paper published reviewing a lot of the smaller studies about this compound, specifically for the treatment of PCOS. And before we jump into it, I just want to differentiate that inositol is divided into two different categories. So we have what's called myonosetol and dechironinositol. So they're both inositol, but they have a similar structure, but they have very different functions in the body. So inositol helps to sensitize the body to insulin. It helps to sensitize the ovary to FSH, which is the main hormone produced from one of the two main hormones produced from the pituitary gland that regulate follicle growth and ovulation. And dechironinositol in the ovary actually helps with androgen or testosterone production. So it helps with the production of male hormone. And so both of these have a very specific and interesting role and synergy together in how they work. And in the body, when we work with PCOS patients, one of the main common diagnostic criteria we see, or one of the symptoms we see, is that usually there's poor insulin sensitivity. In fact, it's estimated to be an issue in up to 40% of patients with polycystic ovarian syndrome. And this is such a huge thing to identify, and I find that usually patients are doing the wrong blood tests to even diagnose this in the first place. They're checking for HbA1c, or they're checking just fasting glucose. Basically, we're screening for pre-diabetics or diabetes. And there's actually much more specific testing that can be done, such as the HOMA-IR, which checks for insulin sensitivity before a patient becomes diabetic. And it's usually something we pick up as a much more sensitive test to diagnose this issue in patients with PCOS who have otherwise been told, hey, everything's absolutely fine. So we look at this and additional specific testing to help diagnose this issue, and diagnosis is half the battle. So once we have this information that insulin sensitivity may be an issue for your PCOS, then the treatment starts to become a lot more clear for us on how to help support the treatment of PCOS. So inositol is this wonderful compound which is present normally in the ovary, and we have a specific ratio of myonosetol to dechironinositol. Usually in the ovary it sits at about 100 to 1. That's the ratio. And we've seen in research that if that ratio drops to 70 to 1, so myonosetol comes down and the relative concentration of dechironinositol comes up, we actually see a decline in egg quality. The issue with PCOS is that ratio, instead of being at 100 to 1, is actually 0.2 to 1. So a myonosetol is significantly deficient in most of these PCOS studies where we're checking for the concentration of myonosetol to dechironinositol. So myonosetol, when it's supplemented, and it's not usually used on its own. We usually use it as like a combination protocol where inositol has a very specific function, works synergistically with other supplements and micronutrients and antioxidants to help with PCOS. But inositol on its own has this very cool function where we've seen in studies that it can actually start to regulate cycles. So starting to have more regular ovulation, having more regular periods, and having not this extended period we're having months and months. Sometimes it can help to shorten that cycle, so it looks more like a healthy 28 to 30 day cycle. And again, this varies from patient to patient. It's not a cure all for all PCOS, but it's definitely an important compound to look at when we're doing a integrative and holistic approach to treating polycystic ovarian syndrome. And The ratio in the supplements in the studies also varies quite a bit. So some of the studies are using a 40-to-1 ratio of myonosetol to d-chironosetol in the supplement. Some are using 20-to-1, and they show different outcomes. So we see that sometimes a 20-to-1 ratio works better, sometimes a 40-to-1 ratio works better. So that's not very clear on which is best, and may actually depend very specifically on each patient, their case, their symptoms, and symptom severity. And so this is very important to discuss with your licensed naturopathic doctor, to discuss what the optimal dose for you might be, what the optimal ratio of these inositols would be for your treatment plan based on your case history and your fertility history as well. And it's what gets me very excited when we look at this compound for IVF specifically. So we've seen that taking inositol can help to regulate cycles and make them healthier, but what happens when patients take them with IVF? And what we see is that we basically need less medication for these patients. The gonadotropin mimetics, so like the stimulatory and ovulatory injections that patients are usually given, like Gonal-f and Menopur, usually we need to give more to see a better response. What we see with inositol is because the ovary becomes more sensitive to FSH and FSH mimetics, we may actually need less of these medications to see a similar response. So we start to see that we don't see an increase in the number of follicles, but the size of the follicles starts to increase. So we see a better response in the existing follicles there. And most importantly, like the main outcome we're all hoping for here, is that we actually see clinical pregnancy rates go up. And part of that reason seems to be because we see embryo quality go up. So the egg quality seems to be better as well. And what's very important to mention is with polycystic ovarian syndrome, we're very concerned about a specific side effect of IVF of the meds called OHSS, so ovarian hyperstimulation syndrome. And this is a very risky side effect with rapid weight gain, fluid retention, and it can be potentially an emergency. So that's why when patients get into this thing, they're very careful ahead of time. If we're seeing like too much of a response, they'll start to pull back the meds and reevaluate if they want to continue or not. And what we see with patients taking inositol is we actually see a reduced risk for this condition, OHSS. So not only are we seeing better outcomes for patients with PCOS in that we're having better ovulation rates naturally, with IVF we're seeing better quality ovules, follicles, and embryos. We're seeing a higher pregnancy rate, but we're also seeing a reduced risk of OHSS for these patients, which is wonderful, reducing the risk of this potentially severe condition. So this is something that we use in combination. We never usually use it on its own, but it's definitely something we've been using a lot more lately for patients, especially patients who have not had periods really on their own without the use of medication for years, and how combining lifestyle, dietary changes, and the important role of various nutraceuticals and nutritional compounds, how they can work synergistically to help regain this hormonal balance and cycle regularity and reduce the risk of harmful side effects. So this is something, before you start any supplement, you should always be discussing with your healthcare provider and a licensed naturopathic doctor to help guide you with this, and working with your fertility physician as well. And as always, if you have any questions, drop us a message or send us a direct message and we'll be happy to respond. All right, take care, everyone.